Hello, hi, good morning from Chennai, and good evening for the Westerners. This is yet another eye-opener video series which we are doing it on behalf of the Madras Medic Forum. As you've been watching for the past few months, that we've been doing all this eye-opener video series to teach the young aspiring doctors and undergraduate students to take up a career in general medicine or general surgery or whichever branch they want. So we have all the experts to talk much on this, and we give them good insight about what they can do in the future. So without any further delay, I'd like to invite my classmate, my medical school mate and great friend of mine, Dr. Aarti Narasimhan, who's a staff physician and an expert in infectious disease, working in John Peter Smith Hospital in Texas in the United States of America. And to describe her, she's an astute physician and voracious reader right from her college days, which I've been witnessing it. And she right now has gone to great heights because of her perseverance and passion in general medicine, and in particular infectious disease. I think she's the antibiotic stewardship director in the hospital too. So I like to welcome on behalf of the Madras Medic Forum, Dr. Aarti Narasimhan for this meeting. Hello, Dr. Aarti Narasimhan. Hi.
Hi, Arun. Thanks for inviting me.
Yeah. Dr. Aarti, from now on, I'll take the role of a medical student, a beginner to start with, and I'll have some few doubts and questions which I'll pose to you. And I think you had to give me an answer for those things, which will give some insights to all these aspiring young budding doctors. Is it okay for you? We can start the session.
Yes, sure.
Yeah, I think my first question to you is like, if I'm a medical student, an undergraduate student completing my internship, and I'm going to start my career, and I want to start a career in general medicine, and later to go ahead with other branches of medicine like what you have done, infectious disease. What would you say as a positive points, or how will you persuade me to take up this general medicine and infectious disease in particular?
Yes, Arun. So briefly, my background, I did medical school in India, followed by internal medicine residency for 3 years. After my residency, I did 2 years of infectious disease fellowship. So I was very interested in medicine. When given a choice between medicine and surgery, I've always been motivated by internal medicine. So that was a no-brainer. Growing up or being in India in medical school, I did see a lot of infections, and it was very organic to me when I decided to pick a specialty, and there was an opportunity for infectious disease available. So I really was interested, and it came organically to me. Infectious disease is a very fascinating specialty. You impact globally in a lot of ways, other than impacting patient care daily. One of the big impact globally is vaccination. So even with COVID, we are really striving to make a vaccine. So I really feel you can make a big impact with infectious disease globally. On a patient-to-patient level, what really motivated me to pick infectious disease as a specialty was treating HIV patients. So years ago, HIV was a death sentence, but it's not anymore. I can tell my patients in clinic, I'm going to give you a pill, one pill, and you're going to have a normal life expectancy like anybody else if you take it and continue taking it. So that has advanced a lot, and I feel with internal medicine and infectious disease, there's a lot of advances happening. I can only speak because all my experience has been in the US, but there are a lot of opportunities within infectious disease in the US. A lot of ID physicians do antibiotic stewardship, which I do in my hospital. So that has a huge impact in decreasing multi-drug resistant organisms. We work with strategies to prevent emergence of multi-drug resistant organisms. Infection control is again another big opportunity. Transplant ID, where we deal with infections post-transplant, is also a great and fascinating field. We also treat patients who are about to embark on a travel. And there are also huge research opportunities with infectious disease. So there's a gamut of opportunities, and you can pick between different things along your career as you go on. So that has really kept me going. I did academics, and then now I'm doing clinical infectious disease. I also see a lot of patients with very complicated infections, patients who are immunocompromised. And personally, I feel looking through their eyes, how they have navigated, their infection in terms of diagnostics as well as treatment, has been very inspiring for me as a physician. And it's really been a joy and privilege to take care of patients with infectious disease. So I would strongly encourage to pursue a career again in infectious disease because of all the reasons I told you.
Yeah, that sounds sagacious reply for the question, Narti. As you know, there's two aspects of anything. While we have discussed about the positive aspects of infectious disease and general medicine career, what would you think as a negative aspects, or in other words, what I can ask is, are there any challenges as you take up this general medicine or infectious disease career, which will think, which medical students will think before joining this career?
Yes, I mean, I have not had any regrets personally choosing my career path, but couple of things I can tell. With infectious disease, it's not a procedure or intervention-based specialty. So if you're somebody who's very interested in doing procedures or interventions, then this might not be a field for you. Again, I look at job opportunities, and you need to have a big hospital with a good hiring potential to have you on board. So there are not opportunities in small cities or hospitals or towns, but that's something I've figured out. So those are the two things I would say to anybody looking at career.
Oh, fine. Yeah, so it means it's not a negative aspect, but it's some challenges you can face definitely when you take general medicine as a career, right? That's amazing.
Yes. Yes.
Can we go on for the third question, Arti? See, my third question would be like, if I'm going to take up a career in general medicine, what way I should prepare myself to take up a career in general medicine and infectious disease in particular?
Yes, so the general medicine, in order to specialize in infectious disease, I really feel you have to love general internal medicine. Because infectious disease deals with all organ systems. We see infections in multiple organ systems, and I get to work with multiple specialists. So you need to have a very good interest in pursuing a career in internal medicine first, with a special interest or focus in infectious disease, I would say.
Yeah, that's wonderful and a very, very balanced statement you have already made, Dr. Arti. So I think this will help all the medical students to take up a career in general medicine and in particular infectious disease. You've got very good insights into them. Now, last but not the least, would you be interested to guide a student in the Madras Medic Forum if they're going to take up an opportunity or a career in general medicine and infectious disease in particular in future?
Yes, I would be. And I really hope this helps somebody.
Yeah, thanks a lot, Dr. Arti. I must first appreciate you for spending your valuable time during this COVID crisis. I know you're all the frontline warriors in COVID crisis, and you've taken all the pains to come and join this meeting. I think this will emulate some students to take up general medicine career and in particularly infectious disease in particular. Like, thank you very much, Arti, for joining this meeting. Have a
Thanks,
wonderful.
Arun, for having me. Thanks.
Thank you, Arti. So students, I think after attending this interview, I think you will definitely have an idea about what is general medicine globally and how do you specialize in internal medicine, how do you specialize in infectious disease and become an expert in that. I think you got some insights into that. And that is what is the aim of our Madras Medic Forum. And please keep watching all our eye opener video series and get benefited. Thank you. Thanks for all your patient listening. Thank you. Bye. Have a nice day.